Moving on to the I in the LGBTIQ acronym, today my Greens colleagues and I were fortunate enough to sit down with members of our intersex community, representatives from the Intersex Human Rights Australia, the AIS Support Group Australia and Agenda, to listen to and reflect on their lived experience. And their visit to Parliament was in recognition of Intersex Awareness Day next Friday next week. Their stories were incredibly powerful. We heard stories from people born with variations in sex characteristics who experienced horrific and invasive non-essential surgeries and medical procedures as infants, children and adults. We heard stories of families with intersex infants, children and adolescents not being given accurate information and not being offered options that respect the bodily integrity of their children. And we heard stories of intersex people not being offered referrals to peer support groups that would help them to feel less alone, to enable them to connect up with others in their situation. And what's more, what we heard, that this isn't the reality of 30 or 40 years ago, this is the reality of people born with intersex variations today. Human rights violations are perpetrated against intersex infants, children and adolescents in Australian hospitals today, and the structures of consent are simply non-existent. Today we were also presented with copies of the Darlington Statement, a joint consensus statement by Australian and Aotearoa New Zealand intersex organisations. The statement outlines what needs to happen to ensure that the human rights of people born with intersex variations are protected, and it outlines a way forward for intersex people to thrive. The statement calls for legal protections from unnecessary medical interventions, together with effective oversight, standards of care and resourcing for peer support and systemic advocacy. Because the reality is that intersex peer support remains largely unfunded and advocacy funding remains precarious and limited, and the few intersex-led organisations rely solely on volunteers to address the many gaps in services left by other well-resourced health, social services and human rights organisations. This is not good enough. One of the most powerful things I heard today was a quip that the I in LGBTI stands for invisible, and in some respects it's true. The representatives I met with are so incredibly hard-working, but they are desperately under-resourced and urgently need more support to continue the important work that they do. My Greens colleagues and I are committed to working towards a future where the Parliament works with peer-led intersex organisations, advocates, human rights experts and health professionals to recognise and respect the human rights and dignity of all people with variations of sex characteristics. And I implore the government to do the same. Please listen to and take note of our intersex community, and please affirm and implement the Darlington Statement and its recommendations. It's so important that you do this. The intersex community's well-being depends on it.